is Dr. Patrick Hu from Moffitt Cancer Center, coming to you from Chicago, Illinois at the annual ASCO meeting. And today we have Dr. Somedeb and Dr. Brian Schlick, who is here. They both won very competitive ASCO Young Investigator Awards. So congratulations, you two.
Thank you.
That's great. Dr. Ball, your work is focused on leukemia, correct?
Yes.
Yeah, tell me about the project.
Yeah, so as you know, acute myeloid leukemia is one of the severe disease, very difficult to treat, especially in the relapse settings. The way the treatment paradigm is set right now is trying to find the mutations in different mutational subgroups and trying to find specific therapies that can target those mutations. Luckily, we have some, and we have some approved therapies for those mutations, including FLT3. We know that FLT3 mutation is seen in 1/3 of the patients with acute myeloid leukemia, and it's even more in relapse settings. And we have a drug, gilteritinib, which is approved for this condition, to be treating patients with relapsed refractory FLT3 mutated acute myeloid leukemia. Recent papers have shown that, the gilteritinib, although it produces some response, we know the response runs out after a while, and patients' disease get resistant to therapy. And recent papers have looked into the possible mechanisms of resistance, and what they have found that there are some aurora kinase upregulation in gilteritinib-treated cells. So in our proposed project, what we are trying to do, we are proposing an early phase clinical trial to be done at Moffitt and with some other centers, including OHSU, where we will test a combination of aurora kinase inhibitor with gilteritinib, and we'll try to leverage the response and hopefully improve the response rate in these difficult to treat patients.
Right, so it's a combination of a FLT3 inhibitor along with an aurora kinase inhibitor.
That's correct.
Wonderful. And Dr. Schlick, you're working on lung cancer.
Yep.
Tell us about where that field stands and what your combination trial is focused on.
Yeah. So in lung cancer, we know that immunotherapy has given a lot of patients very good responses. But some patients, unfortunately, either won't respond to immunotherapy, or those who do will eventually progress on immunotherapy. So we're looking at ways we can augment that response to immunotherapy or rescue that response in patients who previously lost it. So what we're focusing on is a multi-kinase inhibitor called nintedanib, which is specifically targeting the fibroblasts in the tumor microenvironment. So this project is looking at ways to affect the tumor microenvironment to get more immune infiltration and change the immune phenotype within the tumor microenvironment to make the cancer more responsive to immunotherapy. We already know that a lot of patients are having pretty good results with this trial. So my specific part of the project is looking at how exactly are these patients who are previously resistant or refractory to immunotherapy, what exactly has changed in their tumor microenvironment with the use of nintedanib that allows these patients to now respond to immunotherapy.
I see, so they're getting anti-CTLA-4, anti-PD-1, a combination therapy,
Yes.
along with this anti-fibroblast agent, and then you're taking biopsies along the way to see what's happening.
Yeah, we're taking biopsies prior to treatment and after their first cycle of treatment, trying to see how that tumor microenvironment changes with the different set of immune cells to see if there's more immune infiltration. We're also looking at the peripheral immune phenotype, so not just what's changing in the microenvironment, but what we see changing in the circulating in the patient's blood cell.
Well, that's wonderful. That's very exciting. So,
And that reminds me of the correlative part of my project as well, which is the primary proposal around this YIA is looking at RNA sequencing at different time intervals, take on bone marrow samples of these patients to see which are the patients, if we can identify, that would respond best to this combination versus which are the one that would potentially be resistant.
that's the kind of deep science correlative studies you can do at a place like Moffitt Cancer Center with a lot of laboratory research along with a lot of clinical research. So it's wonderful. And that's where the secret is, to try to figure out, is the drug working the way you think it's working, and how can we get it to work better? So congratulations to Dr. Ball and Dr. Schlick for getting this Young Investigator Award. Very competitive award, so congratulations. It's the start of incredible careers for you too.
Thank you.